legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, April 24th. I'm Brent Anir. Tuesday, TMA asked legislators to support a bill to increase safety for patients and others. Temple emergency physician Dr. Robert Greenberg testified before the House Public Health Committee in support of House Bill 3677 by Representative Paul Workman. The bill would allow a treating physician to initiate a 4-hour hold on a patient who voluntarily seeks care at a hospital or emergency medical center, but then wants to leave, although the physician believes the patient is a danger to him or herself or others.
The ability of a physician in Texas to hold a patient without intervention from others, without law enforcement or a judge, until we need them, is really going to help us take care of that patient, maintain our physician-patient relationship, and protect the public as well as ourselves. Because at this point we have no liability coverage when we do what's ethically and morally right by holding a patient who's a danger to self or others.
The bill was left pending in committee. The Senate already passed the measure's Senate companion, SB 359, by Senator Royce West. Your taxes might be going down a bit. The House unanimously approved House Bill 2089 by Representative Drew Darby to eliminate Texas's occupation tax. Physicians are among the 12 professional licensees the state taxes about $200 a year, even though they're also subject to the state's franchise tax. Keep Fitnessgram. That was the message Austin pediatrician Dr. Stephen Pont told the House Public Education Committee this week. He spoke against House Bill 1227 by Representative Rodney Anderson, which would do away with the program. Texas public school districts use Fitnessgram to assess students who take physical education classes, to gather obesity data and develop programs to target the problem. He said instead of eliminating the program, Texas should keep it because it's bearing fruit.
We want to keep the Fitnessgram growing because it already has a number of years of positive impact. It's putting out data that's actionable, that we can take action upon. We're seeing the rates of childhood obesity stabilize, but where they're plateauing is in a terrible place. So this is really a time for a call to arms to continue our action, not to start pulling things back so that we don't fall back to where we were years ago.
This week, the Texas Senate unanimously adopted Senate Bill 207 by Senator Juan Chuy Hinojosa. That's the Medicaid Office of Inspector General, or OIG, reform bill. The measure would improve the OIG's accountability and employ fair rules and processes for physicians accused of fraud, waste, or abuse. The bill clarifies unintentional errors are not fraud. Big news this week about the state budget. The House of Representatives rejected the Senate's version of the 2016-2017 budget this week, so a conference committee will have to hash it out. This is the list of 10 senators and representatives, the budget conferees, appointed by Lieutenant Governor Dan Patrick and House Speaker Joe Straus. TMA strongly likes parts of each budget, like funding for graduate medical education expansion, support for women's health and mental health services, increasing Medicaid primary care payments, and tobacco cessation funding. All are part of TMA's Healthy Vision 2020 legislative blueprint. Check out this TMA webpage for more details, and please type in the web address just as you see it. It's case sensitive. The page has lots of bill comparison info and phone numbers of the budget conferees if you want to call them and ask for their support. Here's another thing you can do. Join your colleagues in Austin next Thursday, April 30th, or maybe the following Tuesday, May 5th, or both. They're TMA's first Tuesdays at the Capitol Lobbying Days. Thursday's event is part of TexMed, and May 5th is the last First Tuesdays event this session. It's crunch time, and I bet TMA's lobby team would love to have you here advocating on behalf of medicine and good patient care. That's all for now. I'm Brent Anir with TMA. Please join us again next time for TMA's Legislative News Hotline.